is changing in a big way, and the key part of it is electronic health record integration. But what exactly it is and why it is so crucial? Well, we have Hitesh Kumar, a software engineer with 5 years of experience in one stack and also has a good knowledge of healthcare. We are going to discuss EHR integration and explore its benefits from streamlining workflow to enhance patient care. We also address challenges and also the technical aspects like common standards and protocols. Curious to know how two different EHR systems talk to each other? We will break down that as well. And we'll explore the real world use cases that showcase the power of EHR integration. And there is much more in this video. So watch till the end and do not forget to like, share, and subscribe. So we're going to discuss, what is EHR integration and things around that. So my first question is, what exactly does EHR integration entails and what it makes such a vital component in modern healthcare?
So basically EHRs are electronic health record systems, right? So we are like going to connect different EHR platform systems with different healthcare apps so that we can have access to the patient information across the platforms or across the devices we have. So by this, like this allows us to basically, because we have the data for the patient, right? And we are using that same data parallelly across all the platforms. So with that, with the help of that, we can make better decisions on all the information we have, and this can lead to the better care for the patients.
So can you explain some of the benefits of integrating EHR system with other healthcare applications?
So integrating EHR system with other healthcare applications basically brings numerous benefits. So let me just take an example. So let's say, imagine a doctor is trying to treat you without knowing about the past allergies or medications you have, right? So like here, the integration helps avoid this scenario, right? Because now you have all the information, right? So I guess some of the benefits which we have is like first one is like we have better care for the patients, right? Because doctor can see the full history of a patient, right? Which can lead to the more decision a doctor can take about the patient, right? Second, we have basically we can say it can also reduce the errors. So basically, normally we are like entering the data manually, right? So here we are not going to enter the data manually. We are just fetching the data from the HI systems, right? So because we are not entering the data manually, so it will reduce the errors, obviously, right? Then it will also gonna save time because let's say it's a streamlined process, right? And now the doctors, because the doctors already have your data, right? So they will spend less time on the paper, we can say, and more time with the patient. So basically they can focus more on the patient side. And last one is like we can say it improved the communication between whoever involved in the patient care, right? So we have doctors, specialists, then we have pharmacies also, right? So because these all people are seeing the same data of a patient, so it also improved the communication between them.
Mm-hmm. Okay, got it. So, like, are there any potential challenges associated with EHR integration? Because there's so much of data and how,
So basically, there are some challenges we have with HR integrations. So first one is like incompatibility. So basically, different HR systems are providing data in different formats, right? So at that time, there is an issue of incompatibility. So might be your like let's say you want to integrate some HR platform in your system, right? But your system is not able to get the data or not able to convert the data in your format, right? So first one is that incompatibility issue. Second, the most important issue is like the data privacy, right? So here we have, because whenever we are dealing with building the applications, HR applications, so that time we have to focus more on the data privacy and security, because we are sharing the real data of the patients, right? So we do not want like any unauthorized user to access that data, right? So at that time so that's why data privacy is also important. So we have to take some security measures before building these HR systems. And then I guess it could have like so basically every day that the technology is advancing, right? So we have to make our systems like the way that it should be compatible with the future advancements, right? And we have this HIPAA compliance also, right? So it's also for the security, so data privacy and security. So these HR systems should follow these compliances also.
So my next question was that only. So, there are some common standards and protocols used in EHR. So what are those?
So mostly they are like for storing different data, we have different protocols, right? So first one, if I talk about, is HL7, right? So it stands for Health Label 7, right? So it basically defines like what kind of data or data elements you are going to share, like you are going to exchange with these EHR systems, right? So this is like HL7. Then we have FHIR. So FHIR is the like we can say is more in demand and more updated, because so here also we are talking about the exchanging of data only, but it's a standard and it provide data in a more flexible way, right? And then we have DICOM. So whenever we are talking about the images, right? So like we have these X-ray images, then we have CT scans and all these images, right? So whenever we are talking about these imaging, so that time we have this DICOM, DICOM protocol. So basically, it defines. So it stands for Digital Imaging and Communication in Medicine. So whenever we are talking about storing or exchanging the images, right? So that time we have to follow the standard. And the last one is CCDA. So CCDA is basically whenever we have these clinical documents, right? So we have the clinical notes of patients or doctors. So whenever we are storing these, so that time we have to follow the CCDA protocol. Yep. So these
Okay.
are the, I guess these are the mostly commonly used protocols we have in EHR systems.
How Smart on Fire is used in EHR integration?
So Smart on Fire, we can say, is a technology so that allows developers to integrate these healthcare apps within the EHR systems. So basically, whenever you are trying to authorize with these EHR systems, right? So instead of like going on like opening your app somewhere else, so you are going to open that app in the EHR system only. So kind of uh, you can say a nested window will open, iframe kind of thing will open, and you can just uh, access the data from there.
So we were talking about, integrating data and all. So can you explain the process of integrating two different EHR systems?
Okay, so if we talk about the process, so basically we have to follow some steps. If we start from the beginning, so first we have to evaluate the compatibility, right? So we have talked about the compatibility issues, right? So we have to first evaluate the compatibility, whether these EHR systems are compatible with our system or not, right? Second, then we have to identify and map the data. So whatever data we are getting, right? So whether we are getting all the data pointers or not. So we have to check that also. And then after, when we are sure that this EHR system is compatible, and it is also following we are also getting the data elements from that. So then we have to think about the security measures, right? So to protect the sensitive patient information, right? So then we have to think through the security. Basically, we have to think through the data privacy and security. So I guess these are the 3 pointers. These are the 3 steps we follow basically to integrate these EHR systems.
So, like, we're talking about data security, right? So there are, like, how data security and privacy plays role in EHR integration.
So basically, data security and privacy, we can say, is a paramount, right, in EHR integration. Well, because here we are talking about the patient information and practitioner information. So practitioners are basically doctors or clinicians. So these all people are coming the practitioners, right? So here we have to like think through the security in a way that no unauthorized user or like no other person can breach the data, right? So that time we have to just follow, like we have to just follow some encryption standards. We have to follow some access controls. So let's say a patient can access only their only patient's data, and doctors can access doctors data, like patients data and their data also. So we can have like multiple access controls. Then we should have regular audits on the data, right? So we can just check like what are the things going in a wrong way. And same way we can have this staff trainings also, because managing the data of these EHR platforms and using these EHR platforms is a bit complex, we can say. So that time we should have these training staff trainings also. So yes, and these healthcare providers must follow these strict rules like HIPAA, right, to safeguard the patient information.
Okay.
Hmm.
Can you share us some examples of successful EHR integration on the project you have been involved? And can you share some use cases as well?
Yes. So yes, we are building a product. So we have named it a HealthConnect. So basically, it is a one-stop solution where we can integrate multiple EHR systems, we can say. So we have already integrated some EHRs, like we have integrated Epic, So, and we have integrated with Athena also. Then we have integrated with Cerner. So these are the mostly commonly used EHR platforms we have right now. And we can like with HealthConnect, we can easily access the patient information. So we can just authorize the patient on these platforms, and we can just get the data from them, and we can store it anywhere we want. So we have built that product, and and we are plan like it is also going to use the generative AI to provide valuable insights on the patient data we have, so that we get these medical professionals will get them better idea or get the more informed decisions based on the data we have.
Okay, okay. So, can you tell us how EHR integration can improve patient care coordination?
So imagine like same example. So like imagine all your doctors have same data, right? So you have some data and all your doctors will have the same data, right? So based on that data, it is like they can make the better decision, right? So they have all the history about the data, so they know like what are the allergies you have, what are the medications you have used previously, right? So based on that, they can provide a better care for you.
Actually, that becomes difficult because when I go to one doctor and that data is like you have to store it, and then if you go to another doctor for consultation, we need the previous history of like what was the
Right, right.
prescription that we
So
need.
for that, you have to carry your reports every time, right? To the every doctor. These are the medications I am taking, and for these issues, I'm taking these medications, right? So you have to explain these things every time to every doctor, right? So this will automate. So because doctors can see the whole data of you in front of them and sit, so they have the better picture. Yes, you have these allergies, you are using these medication. So I can how should I treat her based on the current illness.
So, can you tell us some emerging trends in EHR integration that you find exciting?
So basically, I guess right now we are moving more into this machine learning and artificial intelligence to get the more insights about the data. So because we have a lot of data, right, and somehow this machine learning and artificial intelligence is going. So basically, healthcare domains are also trying to use these models to get like basically based on the data they can predict the disease, or they can predict the illness we have, right? Using these artificial intelligence models and machine learning models, we can I guess this will improvise the like based on the data, whatever the patient data we have, right? So they can give the better result, they can predict the kind of, we can say, uh, they can predict these things very quickly and very easily. So I guess this will save time for the doctors also.
How can we ensure that EHR integration is user friendly for clinicians and other healthcare professionals?
As far as I have seen, so basically first we have to simplify the basically the UI experience we have, right, on these EHR platforms. So the because the flow we have, so it is a bit complex. So everyone like, so let's say some newbie comes to these platforms, so they won't be able to understand like how this flow works. Someone has to tell them like, yes, this platform works like this. You have to follow these steps to get the data from these platforms, right? So first one is, I guess, the onboarding of the users. So mostly the UI part and the onboarding. So this should be, we can make it bit simpler, right? So first one is this, and then we have we can because here we are talking about the bulk of data, right? So we have data from different departments we have, right? So so we should also provide like I guess we can also provide the trainings to the staff members, right? So let's say uh, if someone is dealing with the imaging parts, right? Wherever we are dealing with the images, where like X-rays and then CT scans. So we can provide the trainings like how to analyze the data and how to like get the data and how to put that data in a format like, so that these whatever the technologies or whatever the outcomes we want from the data can be easily taken out.
Well, that's it for today, and thank you so much for joining in.
Thank you.
And I hope you guys enjoyed it. So, yeah.